As we started, we were talking of health issues on family levels, and these are different cultures and different backgrounds and religions. Now we are talking at a global scale. I'm now addressing this to Ambassador. You are resourced enough because you are dealing with issues on a global or on at nation level. Our children or our elders educated or resourced enough to know the information about health issues and what can be done to educate a lot of people through government institutions.
Good morning, everyone. Hey, Asimani and Zara. You should give me the energy that I'm giving you. Are you not happy for Ruben? You should be happy for him. Where is he? Oh, yes, sir. Congratulations, my brother. Good morning, everyone. Yes, that's the spirit. Health education is quite tricky nowadays, especially when we talk about this age and time. We are living in a world where information is everywhere. Just by the click of a button, whether you're on TikTok, Instagram, Facebook, LinkedIn, X, Google, information is everywhere and it's at everyone's disposal. Now we get to a point where this information can yield confusion, whether in children or in elderly people. I work in a diabetic hospital. We are a specialized hospital and we specialize in diabetes. So when we have patients coming, they come with a premeditated prescription. They come with a premeditated diet. They come in and they say, Chiremba, shkade. Madi mandipa monjaro ndo iri kutonga masvano. And then obvunza kuti muri kuda monjaro muri kumbonzwei. Ndo yatakatoona pa TikTok ndo iri kutonzi iri kutorapa diabetes. That's the medication that's working for diabetes right now. But this person doesn't care about lab tests, blood tests. We should have an HbA1c where we have to test your blood sugars. You should have BP checked. You should have your UNEs, you know. The next person comes, I'm overweight. Chirimba, so should you please prescribe me Ozempic? And right now, Ozempic is just the talk of the town. It's the trend right now. People don't care about the side effects anymore. Just because someone is telling a story about Ozempic, they think it is the thing right now. They come with a prescribed information. They matondipa yo because in doe irukutora pandeno zikisa weight. But are you diabetic? Do you have any underlying conditions that we have to look at before we give you that medication? So now we need to understand that a health education, it's supposed to be defined as health literacy, where you have to understand and be able to access information and use it effectively so that you don't go wrong. Your health is your wealth. If you just do one mistake, whether little, major, small, whatever mistake that you do, you are gone. And now you can't come back to the doctor and say, Doc, Mimi, you said this. You can't come back because you came with a premeditated prescription that you wanted just because you had a pressure that came from social media. So it is the duty of the government and the social media influencers to know what to put out there. Because if you don't have people at heart, you will kill people. People are dying because of these prescribed prescriptions that are coming from social media and people around our communities. Now we need to have people who are professional. Where you can get the information is very, very important. Just don't get information from anyone just because they said it or just because they have a number of social media followers. Therefore, their information is authentic. It might not be authentic and it might kill you. So you need to visit doctors, professional doctors actually, because right now people are just coming online wearing stethoscopes, wearing their scrubs, saying they are doctors. I was laughing at this other guy who was saying, Kutianza, I'm a dentist, right? Fair and fine, you're a dentist. But he's advising people that when you're brushing your teeth, don't use water. Just brush your teeth, spit, and then you go to sleep. Toothpaste causes dehydration. Toothpaste causes thirst. You would drink water until you can't drink anymore. And you can't go to bed on a full stomach. You'll be waking up every now and then going to the toilet because you've been drinking water non-stop. So this is the education and health education that people are not exposed to. I'll give you an example of COVID-19. When COVID came, everyone had a perception on COVID. No, in Bonatirai, Mukanatira, Oisa Ginger, Oisa Chichi, because it's just like flu. And now we have people who were selling alcohol. Those guys made money those days. They were saying alcohol, inorapa COVID. You just take 2 shots of whiskey and you are fine. Whiskey yakatengwa ndati. Vanhu vachifuna saka chiremba inini nda mwa 2 shots the whiskey dzangu, I think I'm fine. I don't need to be in quarantine or I don't need to wear a mask because whiskey does the magic. Umwe oya with another theory. Unofika magloves kana makubika mari isai mumvura. We were so scared to handle money, do you know? This is the education, the health education that is at our disposal. And if we are not educated enough, we are being disposed to the things that kill us. Because remember, people out there, they don't care about us. They care about followers. They care about the money that comes with whatever they post. So it's none of their business. Whether you get sick, you die, or you suffer from the side effects, they don't care. So it is very important that we become very aware that you should not get information from anyone or from anyone that deem a specialized person if you do not know their background, if you do not know their health levels, their educational levels, how they went with this education, health education, because these guys, they don't care. I'm happy that we have Dr. I'm so happy to see you. She's a dermatologist. And right now, at least now we have a dermatologist in our midst. At least you got a specialized person where you can get information, rightful information, and the right creams that you should apply. Thank you so much, Doc, for gracing our occasion. God bless you. Thank you so much, MC.
Thank you, Doc. Ambassador, this has been very insightful. But I've got a question for you, Ambassador, before I take the question to
Yes.
Dr. Grace. There are people in the rural areas. Because right now we're talking of information being sent out through social medias and all. But there are people down in the villages where they don't have access to all these. As an ambassador, what measures or what method are you going to be using to send this health literacy information to them?
First things first, I should tell you that if we can talk about a safe community in our days, it's the community that is in the rural areas. Those people are very safe. In as much they are exposed to what we say unsafe and unhygienic environments, like they are exposed to unclean water, that's what they deem. But right now they are so healthy. Those people are healthy because they use our traditional indigenous knowledge systems of keeping healthy. They don't eat junk food, and therefore That's the reason why most of them, they live long, because they are not exposed to toxins that we are exposed to. They eat healthy food, such as, especially a number of them, I don't know now, but a number of them are exposed to our traditional meals. And these traditional meals are very, very healthy. And now taking the information that we have, us that are exposed to the health education that is exposed to us, taking it to them, we have to take it in a manner yekuti you don't cause confusion to them. Because, okay, I'll give another example here, COVID. I remember my grandmother would call me and say, saka COVID wacho ari kutaurwa achasvika rini kunoku. Vanhu vari kufireiko nayo COVID yacho. You know, a number of deaths were in town, and in rural areas they were very low. If we were going to record COVID statistics in rural areas, it was caused by those who were coming from town, going there. But if those remote areas were just left like that, without anyone visiting them, those people are very much safe. Now taking the information to them, we can't take it through social media because some of them might not have Wi-Fi, some of them might not have data. We can use community health workers. We can use nurses from their community health centers where they can go and get education from them, or have health awareness campaigns, depending on which disease that we can talk about. For example, we can talk about the chronic diseases like hypertension, diabetes. We can have those community health workers educate the people in the rural areas so that everyone can get the necessary information and the necessary health education that they must have so that we can have a healthy and wealthy communities.
Thank you so much, Ambassador. We can
Thank you so much.
clap hands for our ambassador.